I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay.
Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is measures that matter. My co-host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan.
Hey, Faisel. It's good to be with you again.
How are you doing?
I'm doing great. I'm looking forward to this discussion this evening.
I am too. I'm very excited. Actually, I was just kind of mentioning to you earlier, I had my booster COVID shot on Sunday morning. Earlier this year, I did the Moderna, and on Sunday morning, I had the Pfizer, and I also had my flu shot at the same time. I felt completely fine most of the day Sunday, but then once Sunday night came, oh my gosh, it just completely wore me out, and actually had to call out of work yesterday, which I think was like the first time that I've called out of work on a Monday morning. It was terrible. I felt so guilty to do it, but I'm okay now. I'm up and running, and everything's okay.
Well, I'm glad to hear it, Faisel. All I know is no matter how bad you felt during that vaccine, that was less than you would have felt for the first 30 minutes you were in the ICU if you got COVID and wound up in the ICU.
That's what I was thinking the entire time. I was like, some people are good at being sick. I'm not that person. I'm definitely not that person. I'll go through whatever we got to go to. Well, I'm excited about tonight's topic as well, and with our friend who's joining us tonight. So let's welcome our friend, Dr. Lars Peterson from ABFM. Lars, how are you doing? Welcome.
I'm doing good. How are you, Faisel?
I'm doing well. Doing much better now.
Yeah.
Yeah, definitely doing much better now. And I'm so glad that we can have this topic, discuss this topic for tonight's episode. We had spoken some months back. Yeah, it was some months back about metrics that really matter. We know that there are a lot of metrics that are out there that really frustrate doctors, especially primary care doctors, family doctors, kind of come in the way of the doctor-patient relationship. And so before we get into all of that, for our audience, our audience is a mix of primary care residents, internal medicine, family medicine, doctors in primary care who are interested in learning about models of care outside of fee-for-service, and the direct primary care doctors. So when I think about we know that we're dealing with a healthcare delivery system that's like now almost $4 trillion. And we know that more than a third of the medical care that's delivered in the United States is medically unnecessary. And we know that at least pre-COVID, half of medical care in the country is delivered in the emergency room settings. So it's like we're dealing with a sick system. And if we're dealing with a sick system, we've got to transition to a system that functions better. It would make sense to have metrics that would help us get away from this sick care system to one that's more of a preventive, holistic care system.
I couldn't agree more. Like I'll personally share. I guess I had I see patients. My primary job is at the American Board of Family Medicine as the Vice President of Research, but I still am a practicing family physician at the University of Kentucky in the family medicine residency there. And I had my year-end review with my chair, or the end of academic year review, and I fell short on my quality measures I had to get. And I was like, are you serious? Like because I know I talk to patients about BMI screening, but I felt like apparently that short because I'm not typing in and documenting that I am discussing diet and exercise, which I feel like I do all the time. I just forget to document it. I'm just like, you're just killing me, man. Like, this is like, is this how you really think I'm a good doctor or not? like if I'm like documenting in the right way or somehow forgetting to put things in the chart, which I know it's important, but I'm like, there are other things you could do. And it just, yeah, it drives me crazy that people are all about, having to remember, like we switched to Epic back in June to remember to put in the right dot phrase or capture things, or, just rather than like being able to talk to the patient, have a good conversation and not have that burden on. I think I would love to work in that system, and I'm hoping that the work we're doing at the ABFM and with the stuff that you're doing will help get us there.
Yeah, what we talk about with the patients, we know that lifestyle, exercise, diet, these are the interventions that can have the greatest impact with any kind of modifiable health outcomes. We know this. I mean, it kind of goes without saying. But yet, if we don't click that we talked about these things, we don't get the credit. When it's just like, actually, it should almost be like you need to opt out. I did not talk about diet, exercise, because we always talk about these things in primary care, especially in family medicine. Family medicine is a relationship-based, way of practicing. It's a holistic way of looking after patients. To think that we're not talking about lifestyle interventions and getting dinged for that, it's just ridiculous.
It's a little ridiculous, but
yeah, it's a system that we're dealing with. And so, when I think about metrics that really matter, if we were right now, we're in an unsustainable place, where we cannot continue to have half of our medical care being delivered in the emergency room setting. Right? We all know this. And actually, I don't know, in Kentucky, do you have standalone emergency rooms propping up?
I haven't noticed any. To be honest, I'm not sure if there are. I know there's a lot. I mean, tons of urgent cares are like proliferating everywhere. And I know hospitals. I mean, I guess I am here to talk. So I'll just tell you, like, I dream. I dream of a world somehow like where you drive around. Like I just drove up on a short trip with my wife today for something, and just driving up and down like through Cincinnati and Columbus, Ohio, like just the huge healthcare systems, like all the hospitals you go by and all the billboards advertising, the robot for your surgery. We'll get you in 4 minutes in the ER to see like a clinician, all these things. I swear I have never seen a billboard for primary care. Like to me, like that would be like a sign that we're winning, or like that things are actually shifting, that like relationships matter. Like, our healthcare system X, we have the, primary care physician for you. We will take care of your family. We will meet your needs. Not like we have the best robot, or, everyone loves the robot for surgery, even though it hasn't been shown to really make any difference, but it's a robot because we're fascinated with technology in America. Like I want the robot, and you're like, well, yeah. Yeah, and so I I do agree that we all know that primary care. I'm assuming you've talked about this on podcasts. I watched a few of them, but on prior times, about that primary care is the only specialty. The more primary care physicians you have, the lower healthcare costs, better quality of care, lower mortality, et cetera. I mean, it's strange that we feel like in at least the research world in primary care that we've known this for 20 years and it just doesn't move anything. Still stunning to me, but I don't, still working on it.
Well, in Florida and in other parts, especially over here in this part of the country, they have standalone emergency rooms propping up all over the place. And I know the hospitals are able to do this because they know that a big chunk of the care that's delivered in the emergency room you're dealing with patients that didn't have access to primary care, or were coming to the emergency room for primary care service. I mean, that's what they're looking for. These are hemodynamically stable patients that didn't actually have emergencies. So they're propping up these actually standalone emergency rooms all over, and they're billing at the ER rates. And so if we needed a transition away, which we do, from the emergency room system to the primary care system, I think that the measures that drive people, like if we had to measure what drives people to the emergency room, for their like stable care that could be delivered in the primary care setting, I think one of them would be with trust in the primary care delivery system, not just with the primary care doctor, but it could be with the front desk staff, with your clinical staff, with just the system itself. Like relationship-based metrics, not just metrics on A1C not just metrics like the BMI. I mean, these are things that we do that goes without saying.